I'm Dr. Sharda Jain, Director of Life Care Center. I'm going to talk today about uterine bleeding. Uterine bleeding is a very common problem. Every fifth woman, after she starts having periods, is troubled because of altered heavy bleeding pattern. Now, if she is less than 20 years, then in that particular case, if the cycle is coming less than 21 days and she is bleeding for more than 5 days, and if there is a passage of clots, you should not delay it, because her hemoglobin is going to drop out, her studies are going to get suffered. So please see gynecologist as early as possible. Between 20 to 40 years, this time the bleeding is usually related to pregnancy, because these people are married, and any time in case there is a lapse in using a contraceptive, effective contraception, then in that particular case it is all related to pregnancy. After your doctor's visit and examination, a transvaginal sonography is done and we find out what is the cause, and the treatment is done early. After 40 years, when a woman has got problems, we have to be worried about it, because at that particular time the chances we think that they can be uterine malignancy or can be genital tract malignancy. Again, it's a very simple procedure. After doctor's examination, after an ultrasound, an office endometrial biopsy is done, and that sorts out everything. So the diagnosis right on the day one is done in 90% of cases. At the end of 48 hours, you find you have a full diagnosis. Sometimes the bleeding comes after stoppage of periods, that is after menopause, and that time we view it just like that it is cancer unless proved otherwise. Again, we have to be aggressive here. Along with ultrasound, along with endometrial biopsy, hysteroscopy is also done at that particular stage, and then we want to find out that there is no underlying malignancy. Do not ignore the bleeding problem in your wife, in your daughter, in your daughter-in-law. Seek the doctor's help early. You can visit us on the site of Liberate.